Welcome to today's video, where we'll be exploring antiphospholipid syndrome, or APS, a complex autoimmune disorder that can significantly impact the nervous system. We'll delve into what APS is, how it affects the body, and the ways we can manage it. The exact cause of antiphospholipid syndrome remains somewhat of a mystery. It's an autoimmune disorder, meaning the body's immune system mistakenly attacks its own healthy cells and tissues. In APS, the immune system produces abnormal antibodies called antiphospholipid antibodies. While these antibodies are the hallmark of APS, it's not fully understood why some people develop them, and why these antibodies lead to the complications associated with the syndrome. Genetic predisposition, environmental factors, and infections may play a role in triggering the condition. It can also occur secondary to other autoimmune diseases like lupus. Let's break down the pathophysiology. Antiphospholipid antibodies disrupt the normal process of blood clotting. They can bind to phospholipids, which are fats found in cell membranes, and to proteins that bind to these phospholipids. This interaction triggers a cascade of events that can lead to blood clots forming in both arteries and veins. Within the nervous system, these clots can cause strokes, seizures, cognitive dysfunction, and even damage to the spinal cord. Furthermore, the antibodies can directly interfere with the function of cells within the nervous system, leading to neurological complications independent of blood clots. Inflammation also plays a role, contributing to the damage within blood vessels and nervous tissue. Determining the exact global prevalence of APS is challenging, but estimates suggest it affects between 1 and 5% of the population. It is more common in women than men, and typically manifests during adulthood, most often between the ages of 30 and 40. APS can occur as a primary condition, or it can be secondary to other autoimmune disorders, notably systemic lupus erythematosus. It is considered a relatively rare disease, but awareness is crucial for prompt diagnosis and management. The signs and symptoms of APS are varied and depend on where the blood clots occur. Neurological symptoms are common and can be quite concerning. These can include a recurrent headaches or migraines, seizures, transient ischemic attacks, or TIAs, which are like mini strokes, and full-blown strokes which can cause weakness, paralysis, or speech difficulties. Cognitive issues like memory loss and difficulty concentrating may also arise. Other non-neurological symptoms may include a deep vein thrombosis or DVT in the legs, pulmonary embolism, or blood clots in the lungs, recurrent miscarriages or pregnancy complications, and skin rashes, particularly livedo reticularis, a lace-like pattern. Diagnosing APS requires a combination of clinical evaluation and laboratory testing. Doctors will look for a history of blood clots or pregnancy complications along with the presence of antiphospholipid antibodies in the blood. The key antibodies tested for include anticardiolipin antibodies, anti-beta-glycoprotein I antibodies, and lupus anticoagulant. A diagnosis requires at least one clinical event, such as a blood clot or pregnancy complication, and persistently positive antiphospholipid antibody tests on at least 2 occasions, spaced at least 12 weeks apart. This ensures that the presence of antibodies isn't just a temporary phenomenon. APS can be broadly categorized as primary or secondary. Primary APS occurs in individuals without any other underlying autoimmune conditions. Secondary APS, on the other hand, occurs in association with other autoimmune disorders, most commonly systemic lupus erythematosus. The distinction is important as the management approach might differ slightly depending on the underlying condition. The primary goal of treatment for APS is to prevent blood clots. This is typically achieved with anticoagulant medications, such as warfarin or newer direct oral anticoagulants, DOACs like rivaroxaban or apixaban. The choice of medication depends on the individual's risk factors and medical history. For individuals with severe APS or those who experience blood clots despite anticoagulation, additional therapies, such as antiplatelet medications like aspirin or immunosuppressants, may be considered. For pregnant women with APS, a combination of low-dose aspirin and heparin is often used to prevent pregnancy complications. Regular monitoring is crucial to ensure the effectiveness of treatment and to adjust medication dosages as needed. Lifestyle modifications, such as maintaining a healthy weight and avoiding smoking, can also help reduce the risk of blood clots. Unfortunately, there's no definitive way to completely prevent the development of APS. However, certain measures can help reduce the risk of blood clots, especially in individuals known to have antiphospholipid antibodies. These include managing underlying autoimmune conditions, such as lupus, avoiding prolonged immobility, especially during travel, and working closely with your doctor to manage any risk factors for blood clots. The prognosis for individuals with APS varies depending on the severity of the condition and the effectiveness of treatment. With appropriate anticoagulation, many individuals can live relatively normal lives. However, recurrent blood clots and long-term complications can occur. Research is ongoing to better understand the underlying mechanisms of APS and to develop more targeted therapies. Recent studies are exploring the role of inflammation and the potential of novel immunosuppressant drugs to reduce disease activity. Furthermore, there's increasing interest in identifying biomarkers that can predict the risk of blood clots and help personalize treatment strategies. The future looks promising for improved diagnostics and therapies for individuals with antiphospholipid syndrome.